people have preventative health care, they cost less. People who don't smoke, for example, have lower rates of heart disease, and lung cancer, and all these things. So I think there's significant evidence for those kinds of things. And at the end of the day, that's really what the crux of this whole argument is. I mean, should everybody be covered, and will that significantly save us some money?
You're talking, though, when it comes to things like smoking and obesity, you've read Michael Pollan, you obviously understand. He's a brilliant writer, by the way, and I would recommend anybody read his books to deal with the eating issues we have in this country. A third of our population is obese. 50% are overweight. People smoke. People drive their cars without seatbelts. People do lots of things that are not in their best interest on their own. This is human behavior. How do you legislate that? How are you going to legislate away obesity?
Well, I mean, if you look at what's happened, some of it's legislative, some of it's through other means in our system, but we start making people wear seatbelts. And so that's had a significant effect. We have started, the Surgeon General, it took a while, but we obviously started telling people smoking was bad. We had to drag cigarette companies before Congress, where they lied and said they weren't spiking tobacco with nicotine, and they were. That was our legislative process at work. And they got their pantsuit off them, and they got hurt by the whole ordeal.
Are you saying you're going to do that to chicken McNuggets next?
Well, I'm not going to do anything. But I think what I mentioned earlier, and that has reduced the amount of smoking because it became a national priority. We all know, no matter how much common sense it took, that if you inhale smoke, that at some level that's going to be bad for you, and it's going to cost our whole system money. So we fixed it. What we're saying here is we have very similar problems. And I'll mention, and it was actually Michael Pollan who wrote about, imagine the insurance companies, it all of a sudden becomes profitable for insurance companies to make sure that their people are healthy, the people they cover are healthy. I think that's significant. It goes back to some free market annex. I mean, it will be profitable for them. It will be in their interest to promote wellness programs in schools and to have incentives for their people to participate in wellness programs and exercise programs. And you'll see them naming weight rooms and treadmills and things, because it will become significantly, and it can be transformational because it will be in their interest. And we all know that the profit motive does work, and so there's evidence there as well.
Well, we wish you well in your efforts.
Thank you. Appreciate it.
Thank you, Tom. Ann Kurz. Ann, you go to the microphone. Ann is a retired teacher and librarian from Canfield. She supports a public option to compete with the private insurance companies. It says we need lower premiums and deductibles for employer-provided health care plans. Your question, Ann?
Thank you, and thank you for calling.
Could you get a little closer to the microphone, please?
Yes, I was getting a little tired sitting there, so it feels good to be up and moving again. My question is this, Congressman Ryan, what in addition would you say to extremists on both sides of this issue, particularly your colleagues in Congress, and if you can influence anyone in the Senate, that would help too, and as a representative. What would you say to them in addition to help them support health care reform, health insurance reform right now?
We don't get these opportunities very often to have this kind of significant change and make healthcare a human right. These opportunities don't come along. And it's obviously very difficult. President Obama tried to learn from President Clinton's mistakes. President Clinton came with a very detailed plan to Congress and said, here's what I want. And guys who've been in Congress for a long, long time said, did this guy just tell us this is what he wants? We have a say in this whole deal too. And so Congress got a hold of it. And it died. And so President Obama came and said, I'm going to lay out some parameters and let the Congress kind of work out the details. And then that kind of left it too ambiguous to where people could start saying death panels are in it, and federal funding for abortion, and euthanasia, and all this crazy stuff that's not in there. And now he has been able to reclaim it. And I think that all of these people that I met at the Canfield Fair, at the St. Matthias Slovak, festival, and the Warren Italian Festival in Briar Hill, I put on 10 pounds in August, okay, just going to the festivals. But all of these people recognize that they need help, and these opportunities don't come along all that often. And so if there's one thing I can say to my colleagues is, let's take our time. We don't have to force this down anybody's throat. Let's do this right. Let's be responsible. Let's get consensus. This doesn't have to be left or right. This needs to be something that's going to help American people. And I think we're getting close to that. And I think we're getting real close to that. And I think we need, the one thing is, this is the time to do it.
Thank you. I was one of those people at the Canfield Fair, and we collected 1,400 signatures for you. And I would like to present them to you tonight.
All right. Very good. Thank you.
Thank you, Ann. Maria Saletti. Maria is a registered nurse and medical administrator from Niles. She feels that the insurance companies have too much power over who gets care and what it costs. Your question, please.
Originally, my question was about the public option, what effect it was going to have on the commercial insurers. Right now, they kind of regulate who gets care and who doesn't. Having a public option, how is that going to affect the commercial insurers? Is it going to put the brakes on some of that?
Well, I don't know if the public option would as much as the insurance reforms would. The public option, I think, would help control some costs because the idea with the public option, as I said, there's going to be this supermarket, this exchange where all these private insurers could go. And they're going to have all these different plans. There'll be the essential benefit package, which everyone has to offer. But then they can offer premium plans, Cadillac plans, really high-end healthcare if people want that. All of those can be offered, and the public, plan would compete with that. And the idea is that the public plan is not going to have to pay their CEO $150,000 a day or an hour or whatever it is they're making these days. I mean, there's significant money that goes to CEOs. There's a significant amount of money that they spend on advertising. There's a significant amount of spending that the private insurers do that a public option wouldn't have to. So that would that would compete with them, and it would help bring down some of the costs, is the idea, because they wouldn't be spending money on all these other things. So it would help with costs, but I don't think the public option would necessarily help. The reforms would help on the other side, saying you can't deny pre-existing conditions, you can't, there's only so much you can spend a year, all of those kinds of things.
But it wouldn't put them out of business, is what I'm saying.
It would not put private insurance out of business. The Congressional Budget Office did a study, and they said in 10 years from now, only about 10 to 12 million people would actually go and access the public option. And the Congressional Budget Office is sometimes, it's very critical of both parties' ideas. So it's nonpartisan, it beats Democrats up, it beats Republicans up. But in their analysis, they said in 10 years, 10 to 12 million people would then would probably be in the public option.
Thank you.
Thank you, Maria. Kim Zeidenstein. Kim is an occupational therapist from Boardman. She supports health care for pre-existing conditions and thinks that health care needs to be more affordable. Kim?
Thank you. Congressman Ryan, my question is really about home care, and I provide home care. I've done 28 years as an occupational therapist, and I've provided all arenas, but one area that I found to be most cost-effective is home care. And as earlier someone mentioned, Medicare is looking to cut that again in January. And I was wondering how healthcare reform might look at home care and explain if there would be any additional reason to keep it in the healthcare reform.
Well, again, I think we will take care of that cut that is proposed. I think every year I've been in Congress, there's been a proposed cut, and whether it's physicians or whatnot, we ended up fixing it. Not always to everybody's satisfaction, but this is a reason why we have to have health care reform, so we're not doing patchwork every single year. But I think home care needs to be a part of this, because there are significant savings when you go to home care and you take people out of hospitals and different